And then you'll see like where I'm going to get from. Hello.
How you doing?
Good, how are you?
Good.
Yeah, Brett, I'm going to sit down. And then, so like, you get like this is the Zoom. So, do that. And then, where do you want? I have questions for Michelle. You want like the,
Oh, I didn't know Michelle had a
so,
question.
also access. So, no, no, you want to practice that.
So this is in.
Yep, that's it.
And then this is.
Yeah, so you can even like, it's like if you want to do like really close on the screen, like right, and then you can practice.
Is it last week?
Yeah, so nothing. So then once you
Or
have
was
it
it-
balanced like this, and
Yeah.
all good, so like we usually, to move it, like this lock up front here, we like to move it side to side. So if you turn it,
That I was
then you
looking
have it
at.
like
You see that?
stationed, right
Yeah.
on, right.
Like the color of
But
it?
if you want to move it.
No, I
you
actually
move
did
it
it.
on the
Wait, I
side.
gotta show you.
I was
If I
like,
move it.
there's something in my
Yeah.
ear going to keep it there. We just try.
Perfect.
So, if you want to, yeah, so just move like that, and then you turn the front
I think
dial.
it's hilarious.
I have no idea what that's for.
Awesome.
No, I don't know if we're doing one today.
We do
But-
have, like, the wires to mics. So like, here's the mic, and then this would be like the bottom of it. So just like this.
Yeah.
I personally don't use these because if you want a battery in the middle of it,
It's done.
especially when I go into a place like this.
Yeah.
So I use the cable.
Okay.
Usually I'll just have this on the computer. So you want to plug this end, we'll go into like number 1. Yes.
There we go.
You would like snap in.
There we go.
And then if you want to connect the mic to this end.
You get it in?
Yeah.
Perfect. And then this is the mic stand. So you have to see how long the cable is. Sometimes there's this movie camera up. Which will move it up a little bit. Perfect. And then perfect. And then it should say, yeah, that stand is heavy, so.
Okay.
And she likes it too, but. So yeah, that's just. So then we stream these, over. So this is like the one we have to let it go. We can go live. So you just power it on. Look at this. And then this cable will go in this outlet here.
Okay.
Mic check, 1, 2, mic check. Mic check, 1, 2, mic check. Check, check, 1, 2, check,
And
1,
you
2,
gotta-
check.
You just pick
Mic check,
one
1,
and
2,
you're clicking.
Yeah.
check, check, mic check, 1, 2.
That is that.
This is kind of getting a signal. Mic check, check, mic check, check, check.
And you see the thing,
Okay.
from the camera.
Check, check.
And then all of these dots,
Mic
are
check.
going to go green.
Okay.
Mic check, mic check, mic check, mic check.
So pretty much when they're all.
Check, check.
We'll do slide it on that. And we'll try it again, and we're going to keep it 2. Slide down to 2. And then we'll go down. And it gives you a measurement.
And then in the newsroom, they'll like throw it over to Facebook.
Yeah, that's like the stream up, and so then they will, they'll have a level two run, so. I think that's it. Yeah.
Oh, yeah. Can you just slide them to me? I'm going through my questions right now.
Hey, it's Casey. Can you see everything okay? Okay. Perfect. Yep. Hang on 1 second. I just did, but I'll do it up here. Mic check, 1, 2, 3. Mic check, 1, 2, 3. Great. Alrighty. Yep, and I think you can probably just start it whenever. Okay, thanks, bye.
Yeah, absolutely.
Whatever's easier for you.
So we'll do it one here and one like kind of take it down and we can do it.
Yeah.
Are you just starting?
Yeah. Yeah.
Welcome. Yeah.
Thank you.
Are you going to be a profile reporter?
Reporter.
Reporter.
Yeah.
And then Jake Ryan.
Yeah.
And are we going to do some like merch? We should televise them soon. So easy.
Mic check 1 2 3. Jonathan, mic check 1 2 3 4 5. Probably this loud. Maybe.
Your arm candy, huh?
Yeah. You didn't hear that.
Everyone good? Good afternoon. I'm Dr. Sandra Martell. I'm the public impacted our hospitality industry, including restaurants, bars, and the travel industry, our cultural institutions, museums, performing arts, our sports, from schools to the professional competitions that we normally would host, to our students who have missed proms and graduations and homecoming and their sports, to our communities of concern, including our minorities and people of color, who experienced higher hospitalization rates and higher mortality rates, to our locations of concerns, our individuals in the congregate care settings. Throughout this, they've been isolated and have also suffered for increased mortality and death. You're right, unfair. And now we come to vaccinations. Appointments are not being provided by any system within Winnebago County unless vaccine is available. And it's important to understand that's why people who have registered have not gotten appointments yet, because we can't schedule too far in advance without an adequate supply of vaccine. Everyone is working to vaccinate as quickly as possible. We know the state of Illinois has a phased approach, and we're also applying an equity lens against that phased approach. So when you call, or when you write us, or when you want to talk to about being unfair, think about what can you do to encourage and support vaccination efforts. Instead of saying it's unfair, you have to register online, help a neighbor register on the variety of systems. We've said before, take vaccine from the first system available. Limit your emails and contacts to health system providers who are working to schedule and provide vaccinations. Be kind and respectful to the staffs that have been working throughout this pandemic and are taking the calls. Remember, it's been unfair to them as well. Do not personalize when you call. Nobody is deliberately denying or not giving someone a vaccine dose. We're in a phased approach. And please do not call and ask for favors. The stories of every single individual in our community are compelling. But we can't manage the individual personal requests. While this pandemic is not fair, you can choose how you respond. And choose to respond with kindness and equity. We are working to make this and be able to vaccinate as many people as effectively and efficiently within phase through an equity lens as possible. Healthcare providers are focused on vaccinating their enrolled populations who have had an encounter in the past 18 months. I'm often asked, well, when is my turn? When do I get it? So all of our healthcare partners, Crusader Community Health, OSF Healthcare, Oak Street Health, UI Health, LP Johnson Miles Square, Mercy Health, and Swedish American Healthcare are all working through their client enrolled populations. And the majority of the vaccine has been allocated to these healthcare systems based on their enrolled patient numbers. But vaccine supply is currently not adequate to cover everyone who is eligible in Phase 1B. And if you're following local, state, national media, you know that that is the case. And the healthcare systems are prioritizing based on age and comorbidities. Because I've heard, well, why is someone who's 65 receiving it ahead of someone who's 75? Well, the 75-year-old may only have one comorbidity, and the 65-year-old may have 5 comorbidities and be in one of these frontline worker positions. So the healthcare systems are working out various methods. It could be through their MyChart. All of our systems use Epic for the most part, the 3 hospitals. And again, if you've not enrolled in MyChart, they'll reach out to you by telephone. Some of them are actually engaging community outreach workers like Oak Street Health. or email. But I want to remind the public, get vaccinated at the first available opportunity and keep your appointment. That vaccine dose has been reserved for you when that appointment is made. That means they have the vaccine available, and it is got your name on it. If you have registered online with Winnebago County Health Department and have received an email confirmation, you are still on our list and will be notified when we have an appointment available for you. You can decline that appointment if you've been vaccinated elsewhere at that time, but you've not come off the list. Winnebago County Health Department and select partners, including Marathon Health, Rosecrans, Winnebago County Wellness at Swedish American Better Life Wellness, are focused on vaccinating frontline workers in Phase 1B and catching up Phase 1A outside of the healthcare systems. So today I want to do a shout out to Rockford Public Schools and my nurse colleagues and staff support there that we've started vaccination teachers in the RPS system. We are also reached out, I hear, are we also doing private schools? Yes, we are working through every system. But just like every place, we're looking at those that have the largest population base first. We also are going to be reaching out, and we started the contacting of our food processing plants in Winnebago County. We're continuing with our first responders. Some of our first responders may be vaccinating in a school with that teachers group, and if they're in an associated area. Our grocery store workers, think of our Big Myers and our Woodmans and our Schnucks and our Aldis. All of those individuals need to be vaccinated. They were essential front line. They did not have the choice to stay home when we were in our stay-at-home all-in for Illinois. These individuals were deemed essential and continued to work in person throughout the pandemic. So it is a process and it's a plod. We talk about the marathon. But again, while it may seem unfair, we are working through to fairly vaccinate, to ensure that everyone who wants a vaccination can receive it. But I want to keep reminding you, it won't be tomorrow. It won't be next week. Your neighbor may be vaccinated ahead of you. Someone sitting in your car may be vaccinated at a different time in your household, depending upon where they are in the phases. Today, we're reporting 69 new cases, which brings our total case count up to 25,963. The good news is our rolling 7-day positivity rate is at 4.7%, and we have no additional deaths to report. But our total residents of our community lost to COVID was over 400 at 404, and no new locations of concern. And Rosecrans Harrison campus has completed 2 incubation periods without any new cases. And as of Monday, Rockford hospitals, including Mercy Health, OSF Healthcare St. Anthony Medical Center, and Swedish American, are providing care for 50 patients who have tested positive for COVID-19 and persons suspected of COVID-19 positive. This is an increase from Thursday's report of 48, and again, we will release those numbers again on Thursday afternoon as we have. So while we are in this phase 4 of the Restore Illinois plan, and we're in phase 1B of vaccination, and we are no longer under the tier mitigations, we have to continue our vigilance on this. We have to continue to wear our face coverings, maintain our social distance, stay home when we are sick, and when our term comes up and we get an appointment, we should make sure that we take the first available appointment and get vaccinated. And remember, again, to be kind and respectful to each other, to understand that this is a long process that we are working toward, but everyone who wants to be vaccinated will be vaccinated. And with that, I'm going to turn this over to Mayor McNamara.
Thank you, Dr. Martell, and thank you and your team for your leadership throughout the pandemic. Also want to say a special thank you to Lee for providing the American Sign Language at each one of these press conferences. You're a critical piece to our communication, and just appreciate the work that you do on behalf of all Winnebago County residents. So as Dr. Martell mentioned, we are really excited from the positivity rate at 4.7. I don't have the exact date, but it's been months since we've been under 5, and I believe this is now 2, maybe 3 days that we've been under 5, and that's a testament to the healthcare workers. It's a testament to Dr. Martell and the Winnebago County Health Department. It's a testament to our employers who are out there caring for their employees and ensuring that their customers are being taken care of with all precautions and mitigations taking place at their places of business. It's a big testament also to the restaurant industry and hospitality industry that now has been open for a couple of weeks, where we typically would see a spike, and they have really done a fine job. So I want to just say a big thank you to all those who help us continue to see that steady progress as we continue to battle COVID-19. We have heard that vaccinations continue to progress. I think we are now nearing 20,000 residents in the county who've received the vaccination, and so we are making that steady progress. We've seen businesses continue to reopen, and with that, starting on February 8th, this coming Monday, City Hall will reopen. We'll have a host of mitigations in place. We will have the temperature scanner at the front door. Everyone will be mandated to wear masks. We would ask if you can continue to do business online, please do so. We want to take all precautions possible. For City Council, we'll have in-person council, but it'll be a little bit unique with staggered seating, and also we will not have the public in the actual council chambers. We'll set up a very socially distanced opportunity. If those who want to come speak, they'll be able to come in, speak, and then they can watch council from City Hall lobby, which is a lot more open and safer as we deal with the pandemic. So we have a long way to go. We still know people are struggling. I mentioned this last week, but just want to get out 3 important numbers because we're seeing increases in all 3 areas. One is if you are someone who is a survivor of domestic violence or experiencing domestic violence in your household, please reach out to the Family Peace Center. Their number is 779-348-7600, 779-348-7600. Also, we've now provided over $5 million worth of assistance and relief for utility bills. So if you would like to schedule an appointment to meet with our city staff, you can do so for assistance with your utility bills by calling 844-710-6919. And also, we know that there is a tremendous need in our community for rent and mortgage assistance or relief with your water bills, and you can call 844-710-6919 for that as well. One thing I want to mention that Dr. Martell did not mention, this weekend is Super Bowl weekend. There is typically large gatherings during Super Bowl weekend. I would just plead with you to continue to have focus, continue to be vigilant. Make sure that you're washing your hands, make sure that you're taking precautions. We're not naive. We know there'll be some gatherings, but we also know that there's certain mitigations that you can do in your own home with even your own friends and family that can really help us all limit the risk of exposure and help us keep that positivity rate down. That helps all of our healthcare workers, helps our kids being in school, just helps our businesses and our community at large. So please, wear a face covering, wash your hands, practice social distancing, and probably don't bet against Tom Brady. So with that, I will hand it off to Dr. Martell unless you have questions.
Okay, I know you did touch on this already, but regarding the hospitals in our area and going back, could you just explain someone 65 has diabetes versus someone 70 has asthma, the 65-year-old getting Paul versus the age? There's just so many questions about that age difference and what's being utilized.
Okay, so the question is, how are the healthcare systems doing it? Well, we've already kind of identified let's say they have 30,000 and maybe they're getting a couple thousand doses, right? So they're going to comb through what's called the electronic health record, and based on the diagnoses that are most associated with high mortality and morbidity rates from COVID, in addition to age, are putting those together and pulling through their most at-risk individuals. So Oak Street, by nature of the fact that it's primary business is over 65, they're doing their method a little bit different because they have 65-year-olds who are continually coming in. The hospitals are having to pull through. If you think about the healthcare systems, and they're not just hospitals, I should say healthcare systems, are combing through those records and then pulling individuals in. So again, it really is based on that kind of comorbidity in addition to age. And I know that that's hard because you think, I understand, and I hear the word unfair a lot. I see that, it's not fair, I should get it first, how come they're getting it first? And it really has to do with that weighting of those factors. We also know that in the age 65 and above, they may seek care from all three systems, right? So they're not always restricted by health insurance plan if they have Medicare. And so again, they may be called by one system ahead of the other, depending upon where they are in their process. So I come back, take the first available dose. Don't make judgment about someone else who's getting the vaccine because you may not know all of their medical history, right? Because this is generated by their electronic health record, not by positive responses to questions. This is generated by diagnostic codes that are put in when you go in to see your healthcare providers. And the third is to understand that everybody is working towards. So even within a household, one of the spouses may get it ahead of the other. And, and then I also want to be clear that places like Walgreens, right, or the pharmacies, their systems are entirely different. So I know people say, how do I hedge my bets, right? We're coming up on Super Bowl, right? I don't register at Walgreens, register at Myers, register online at, Winnebago County Health Department, and wait for your provider to call. And take the first one that calls you. They're all using the same vaccine products. Not one is better than the other. And I know that that's hard because, again, without some of that discussion, without a statewide system or a nationwide system, there are multiple registration systems. And we're not bothered by the fact that you register at multiple locations. We will not be hurt that you didn't come to Winnebago County Health Department, that instead you went to Walgreens or your healthcare provider. We're going to be happy that you got vaccinated.
And touching on that registration, will you guys help filter into the healthcare systems, or is that two different topics?
The question is, are we going to filter into healthcare systems? We will not be filtering into the healthcare systems because they're going to use their electronic health records, which have the complete diagnosis. Remember, it's self-attestation, meaning we ask people to respond positively. We do not confirm diagnoses. So if you put on our system that you had heart disease, we believe that to be true and honest. Whereas in the healthcare systems, you'll actually have what's called an ICD-10 code associated with that diagnosis of heart disease.
And then you touched on that pharmacy portion. Is the health department involved in that at all with dispersing the vaccines to local pharmacies? The question is, are we involved with disbursement to local pharmacies? Not at this time. The state is working through some of those plans. We don't know where that's at, but as of today, we are not involved with disbursement of vaccine to the pharmacy partners.
Dr. Martell, does it just come down to there's just not enough doses right now to meet the demand?
The question is does it come down to there are not enough doses? That's a huge part of the problem, right? But even if we had, let's say we had one dose for everyone who wanted it today, we still have to get systems so that we can actually get people vaccinated. I can tell you that people tend not to like to be vaccinated after certain hours, on certain days of the week. We find that, it's not convenient. But even if that were the case, there probably would be some other points that people would not. People travel. We've heard some people want to get their vaccine, and should they come back for their second dose if they're a snowbird and they're traveling to Florida or Nevada or someplace else. And again, I come back to, this is really a very different time. If we thought a pandemic was convenient or fair, I want to remind people it has not been fair, and it certainly has not been convenient for any of us.
Are there any plans to have a mass vaccination facility here in our region?
The question is, are we looking at mass vaccination? Of course, that's one of the opportunities with the state that we have obviously asked for resource. We are one of the state community-based testing sites. But again, they have to look at all of the allocations throughout the entire state. And of course, we advocate for wherever we can. But I want to come back to, we want to make sure that we're still applying that phased approach in an equity lens, that those who most at risk have an opportunity to be vaccinated first.
Dr. Martell, we had touched on RPS 205, starting that process of being vaccinated, and of course to private schools and being in the mix of that. Do we know how many vaccinations as far as a ballpark amount of how many have been to the schools? And do we know if there is a percentage of the vaccines that we are getting in our county that are going to schools?
So the question is, do we have a straight number? So currently what we're doing is we're working with every one of the school districts, finding out how we best pull them together. So for RPS, they have multiple locations, right? So they're pulling together their schools. We're determining, we do use our Qualtrics in the registration system when they are given a code, so we can pull how many people may be coming through. But we also plan for people who may not have used the code or may have come, decided the day of the clinic, you know what, I'm going to get vaccinated. We're all for it. So we started, we did a pilot at South Beloit, but we also did South Beloit Police Department with them. We are doing RPS, several of their school systems this week, and they pulled in their charter schools as well, so that we're able to pull them in. But again, with vaccination being voluntary, it's really, we want to make sure that we have people registered, ready to go, that we're bringing out, again, this is challenging vaccine logistically. And so for each day, we know how much that we're setting aside based on the scheduled visits that we plan to do on that particular day, with some increase, right? So our idea is that we are hitting our largest school districts first. We work with the school planning teams at each of those locations, and we do rely on the school nurses and any support staff at those schools to help us vaccinate. I think we've talked about before, health department is, again, we are not, our primary focus in business is not clinical services, so we have to rely on them to work with us and partner with us to be able to deliver those vaccines. So today, South Beloit was Friday, their school nurses helped us vaccinate their population. They helped us with flow. Today, it was the RPS school nurses helped to vaccinate their staff and teachers within their school district. And they're continuing, in fact, they are ending up just about now. And so I think, again, as you see through, we're going out to the Roscoe area, and I want to remind the community, these are not open, so even if you hear about that, you just can't walk in. These are closed, obviously, for the safety and security of the children who are in the in-person learning environments as well. And then we also have, we have private schools, and so we're pulling them together. Maybe 2 or 3 of them will come together location-wise to vaccinate. And of course, it's a logistical challenge as well, because we can't leave teachers not in the classroom with the kids, right? So we got to figure that out. So we've been very thankful for the cooperation of our regional superintendent's office and the Rockford Public Schools, administration group, because this requires all of us working together to pull these kinds of activities and events off. We also then, too, I think we talked about next week, we'll be going back out giving second doses to our community integrated living arrangements, or SILAs. And so remember, it seems like we just keep rolling, right? We're just keep rolling to make sure we do the first dose, second dose, and then keep moving on. Our long-term care facilities are still being vaccinated through the federal partnerships through the CMS with the pharmacies of CVS and Walgreens.
And do you know, we had said South Beloit, we said RPS. Do we know how many schools in our area have been vaccinated for that first dose?
Right now, how many schools or school districts have started? Like RPS is going to take a while, right? You figure, I think their estimates are, in terms of employees. So South Beloit was the first. We were testing a couple of activities to make sure that we'd rolled out. And again, they were also willing to vaccinate like our other 1B people, right? Police departments that came through. Some of the local fire protection districts that are not EMS also came through. So these are always coordinated with what's the local picture. So even within our big plan, so today they pulled in some charter schools, and at the end of the day, they said there's one school that said they want to come today. We said, bring them on. We're ready. We've got enough vaccine. We're going to take, if you're ready today, we'll vaccinate you today.
And then with that, we do understand that right now it's those teachers, those first responders. For schools, a lot of them are still remote learning or hybrid learning. What do you think it's going to take in order for schools to be back to normal as far as full staff and full students in the classroom?
So the question is, when do we expect everything to be back in full? And I think if you look at the national discussion that's going around this, is that we know that throughout we're going to continue to vaccinate. We know more and more children are coming into the in-person learning environment. And again, as we continue to monitor and watch, there are some mitigations that may be in place, But I think everyone is truly optimistic and hopeful that with our herd immunity, if we get 70 to 85% of the population vaccinated within that school, you know, especially the teachers and staff, we don't yet have a vaccine for children, that we can start to begin to return some of those activities that we would normally have in terms of the schools. But a big step has been made, just allowing some of the competitive sports for the children at that age level. And so, again, kind of bringing that group together. It's going to take everyone really deciding to vaccinate as much as possible who can be vaccinated. We're still going to have to monitor the situation. They've been invaluable from the start of this, their teams in contact tracing and helping us to isolate and quarantine. And while this vaccine is very effective, it still has, you know, nothing is 100%, and we still have to monitor. Plus, we have other kinds of things that go on in schools, as you know, as infectious diseases as well.
So did RPS start today?
RPS started today.
Kind of going back to pharmacies, are there any plans to open up more pharmacies to administer the vaccine? I know the state just announced that partnership to redirect 97,000 doses to pharmacies in our county. Is there any plans to open up more?
The question is, am I aware of any plans to open up more pharmacies in our region? I am not aware of any plans, but that does not mean that they are not being done. These are national change with national footprints. And certainly we have CVS's and Walgreens in our community. And if they were to ask, we would certainly say yes. But again, I want to make sure that systems are pulling those through at highest risk, right, to come in and get vaccinated first. And so that will always be kind of that statement. We implemented a system of scheduling and appointments. I know that people said, why bother? You know, here's the question. We said, look, we know we're going to be dealing with this vaccine shortage. And we were committed to making sure that we could try and identify as best we can those most at risk so we could vaccinate them first.
Now this is a COVID testing question. With this sub-freezing weather coming Thursday and on, are there any plans to cancel testing or bring testing indoors?
We are not aware that that is going to be done, that they are continuing to test. I think, again, most of these locations and sites have planned for inclement weather. I think most of us know, I have to say I'm amazed at the number of our drive-thrus that do that as well. I mean, anyone who's been through a Portillo's and they're like, they have the hot hands on and they have, you know, layers on, similar to that. And so as long as they can maintain the integrity of the specimen, they will continue to test. And if we hear of anything different, we will obviously post it through our website and the media so that people are aware that that testing site will be closed. But at now, there is no plan to close the testing site.
Now, in terms of registering, what about for those people who don't have access maybe to a computer or there's a language barrier there? What are their options?
So there are a couple of options. The question is, what have we been doing about people who don't have technology? So one, we've said this from the start, we've been doing it by a telephone call. We will do that. Our system is capable of multiple languages depending on which browser you choose. You can choose the browser in your language. And I have seen people come through with their registrations in multiple languages, that they've obviously felt more comfortable using that to answer and respond to their questions. But again, I encourage each one of us, you know, do you know an older person that doesn't, and I shouldn't say older, do you know someone who lacks technology access? We shouldn't make any assumptions about who. Help them register, right? Sit down with them on a phone and say, here, I can help you do this. Because part of it is having control over your own, you know, I think part of the fear that they have is I won't get on any system. How will they know I'm here? How will they know I need a vaccine? So again, you know, the systems are not, you know, perfect. We know technology access throughout the country. This has been a discussion and a debate. But whatever we can do to reach out, if you can even register yourself and 2 other people, think of the impact that makes. And again, yes, there'll be challenges when they come in. We will say, you know, do you have your letter or barcode? They may not. We'll look them up by name or phone number, and we bring them right up. And the idea being that we don't want anyone to feel that they did not have an opportunity to be offered the vaccine and choose to be vaccinated.
And should they just call the health department?
They can call our COVID hotline. But I really, you know, again, if we are, I want to come back to, like everything else, resources are not unlimited. So if you can reach out, or if you have a family member that can help you, we have many people that have worked through that process as well. is to register as much as you can online because that information is secure, and your vaccine information then becomes stored electronically and you own it.
Dr. Martell, you kind of answered this question already a little bit with now we know that the Biden administration is working on setting up national vaccine sites. Has there been communication as far as what that might look like if there were to ask our state and ask our region to have one set up here?
So the question is, with the national strategy, and I'm assuming, and I shouldn't, talking about the National Guard setup, is that what you're talking about, using a federal asset like and that's really our local and state asset. If they offer that resource, we certainly will be accepting that resource.
But they would be kind of running it as far as what it would look like. Would we advise where or anything like that?
So the question is, would we want to be able to advise where? And the answer would be, of course we would. We'd also want to know how they're going to help us ensure that our populations most at risk have an opportunity to be vaccinated first. That it's not a first come, first serve, it's not a lottery basis, that we're making sure that those pieces, which were important to us when we went out for a system, are adhered to.
We've heard a little bit of some residents crossing state lines to go get a vaccine. Do you recommend that at all?
So residents, we're going to call that travel medicine, or, do we recommend that? Here's the challenge I have. First of all, I've said before, get it at the first location you can. And we know we're a borderline county, right? So Beloit to South Beloit and back, back and forth. Again, but you want to make sure you're adhering to that state's phase. It may be different than Illinois. We know that some of our folks winter in warmer climates, may get their first dose in their winter climates. You want to make sure you bring your vaccine card back, because how the vaccine allocation works is based on the number of first doses given is in 4 weeks. If it's Moderna, you get your second vaccination. So if we're all of a sudden getting a few, lots more, then we've got to figure out how do we pull that all together. So I say get it at the most convenient location and at the first opportunity that you have for your phase to be vaccinated.
With the Johnson & Johnson coming up as another manufacturer that's hopefully going to be entering the market here, do we know if that's going to be changing the possible doses brought to our area?
So the question is, with Johnson & Johnson applying for their EUA and we'll say approval, our optimism on that, will that change how much vaccine? Hopefully that brings more vaccine into the region and another option. We understand that right now it looks like that is one injection, so logistically not as challenging. But again, we're still going to be committed to making sure that we finish giving a second dose to everyone who got a first dose of the Pfizer and Moderna. And we will certainly, whatever products come on that have EUAs that the state distributes to us through a federal asset, we will use.
Dr. Martell, I know that you mentioned that when you register for the vaccine, just to wait until you get that call. Is there ever a point, though, where maybe too much time goes by that should you recall again if it's been weeks or maybe even months? Does there come a point where you should check up on your appointment at any given point?
So the question is, if you've registered on our site, first of all, it's not a phone call from our site. It's going to be, if you registered online, it's going to be an email. With the exception of that group that we have a special email account set for them that we manually do. Is that, again, should we wait? Well, right now, I've told you that we are still early in phase 1B. So again, when people say, how long will it take? Until, we're getting adequate supplies, and we will let you know when it's wide open at that point. I get more questions about when does phase 1C start. So if you're a phase 1B, meaning you're a person that's over 60, 65 or over, and all of a sudden you're hearing about phase 1C, then you could reach back out to us, but don't re-register, right? It doesn't help, just churn out, because people think by re-registering with a middle initial that the systems are smart enough to know that that's a duplicate. And again, your health systems are working very hard in that 65 and over population and our federally qualified health centers. So if you were someone that was underinsured, uninsured, and used those systems, they too are also combing through their records to make sure that they are pulling through those individuals to vaccinate.
I think at the last update you mentioned that the county was doing around 1,000 vaccines a day. Is that still about where we sit?
Well, right now with all the healthcare systems coming on, it bounces around, you know, so I'm going to say there's at least 1,000 being done a day. And you can look at that from the number that gets reported through the state, and then you see that they now have that dashboard about how much vaccine is out and how much is being done. Any other questions? All right, thank you. Have a great day.